When the province released their budget earlier this year, there were a number of sectors facing cuts. Healthcare was one area that didn't receive enough money to cover the cost of inflation. The Cypress Health region was told their budget would be cut by close to $500,000. The region was told to make up this cost by cutting back on things such as sick and overtime, something the region says they've accomplished.
In the first 6 months of this fiscal year, we've seen a 26% reduction in our sick time hours and a 24% reduction in our premium hours. So those are hours that we pay overtime for. So we're really pleased with the success that we're achieving at this point.
And as this money is being saved in the region, Vishon provides a better idea of how they are executing the initiative.
One of the things that we have been looking at is calling guidelines. So rather than just automatically filling a shift if someone calls in, we're actually looking at things like what are the number of patients, what is the acuity rate for a particular unit on any given day, so that it's really determined, is that the best place for a staff to be called in for if the patient numbers and acuity levels don't warrant it.
The Cypress Health region will continue to cut back on sick and overtime hours, as this was the mandate handed down to them from the provincial government. In the meantime, though, some are questioning what effect this will have on the workplace and on healthcare in the region.
The very real world examples of how this is impacting the residents and the staff in the Cypress Health region. Over the period of 1 week, we got examples provided to us at the Palliser Regional Care Centre. On the day shift, they were 3 SCAs short. So when you're 3 SCAs short, it impacts the day-to-day care of the residents. Another instance was where they wouldn't replace any overtime, so one of our members worked a 16-hour shift. That was 2 8-hour shifts back-to-back. Another example is that we had one SCA working a night shift on a floor, all by herself, and there's usually 2 people working a night shift. This is just an example of the shortages in just 1 week. And while the numbers in the bottom line look fabulous for the report that goes back to the Ministry of Health, what the actual impact is that the residents and the clients and the patients are ultimately paying the price because they're not getting the care they deserve.
Health regions province-wide are being asked to make these cuts, but it's still yet to be determined whether or not this will compensate for the deficit in health care.
I think it was fairly drastic, the cuts that the health districts got. They only got 3.2 or something %, which barely covers the increase in the nurses' contract. And it doesn't even touch inflation anywhere else. So the districts are really struggling. And if there's this artificial hope that you're going to have all your savings made on the back of sick time and overtime, they're going to be sadly disappointed.
Juner adds a better approach would have been to fund healthcare properly and then see what sort of efficiencies could have been made. She also adds that next year's budget may produce fewer dollars and more cuts in healthcare. Residents will have to wait till March to find out exactly what funding will look like for healthcare in 2011. For Southwest TV News, I'm Kara Repke.